You've been lied to about walking. For decades, you've been told it's the safest, most effective way to stay healthy as you age. But what if I told you rehabilitation doctors now whisper something completely different behind clinic doors? A set of daily movements that renew your strength, balance, and joint health without the repetitive pounding that walking can cause. This isn't clickbait. It's science. And if you stay with me till the end, you'll understand exactly what your body's been craving for decades and how to reclaim it starting today. Let me introduce you to Geraldine. She's 77, a retired teacher, sharp as ever, and once proud of her daily 5-mile walks. Then came the heel pain. Then the hip stiffness. Then, one day, her legs gave out on the stairs. The doctors told her it was arthritis. Wear and tear. Age-related decline. But one rehabilitation physician at a small neurology clinic in Oregon told her, it's not your age, it's your routine. He handed her a page with 7 strange-sounding daily activities. She was skeptical. But she tried them. And in 4 weeks, she didn't just walk easier, she moved like she had a new nervous system. You see, by age 55, your joints have accumulated millions of pounds of impact over a lifetime. Walking is repetitive impact. And if you're doing it on worn joints, misaligned posture, or weak stabilizers, you're reinforcing the problem. The spine compresses, knees grind, and hips rotate incorrectly. Yet, no one talks about this. Why? Because walking is easy to prescribe. But smarter movement is harder to explain until today. You don't need to walk longer. You need to move smarter. Over the next few minutes, I'll show you 7 things that top rehabilitation experts use with their older patients, not trends, not gadgets, just proven methods. These 7 tools can restore mobility, ease chronic pain, rewire your balance system, and even boost your brain function. The first shift is spinal decompression. Not with machines, not with drugs, but with gravity. Simply lying on your back with knees bent, feet flat, breathing deeply into your ribs. Or better yet, holding onto a bar and letting your body dangle gently for 10 seconds. You might feel a stretch. That's your vertebrae thanking you. It creates space. And space relieves nerve pressure. Next is neurofoot priming. Every step you take starts with a message from your brain to your foot. But most people's feet have gone numb from shoes, hard floors, and lack of stimulation. Ankle circles, toe scrunches, and slow heel raises on a soft mat can reset these pathways. One patient, Harold, 82, used these daily. Within 3 weeks, he stopped needing his cane to get out of bed. The third movement is scapular activation. You sit in a chair. Wrap a resistance band around your palms. Pull your hands apart slowly while squeezing your shoulder blades. This isn't about muscle, it's about posture. When your shoulder blades activate, your spine aligns, your lungs open, and your core switches on. Fourth, diaphragmatic breathing. Simple, yes, but forgotten. Breathe in slowly through your nose. Hold for a second. Then breathe out even slower. This calms your vagus nerve, lowers blood pressure, and improves oxygen flow. And it only takes 3 breaths every hour. Fifth, dynamic isometrics. Press your palms together as hard as you can for 10 seconds. Then your fists. Then your heels into the floor. No movement, just muscular intention. This teaches your brain to re-recruit neglected muscle fibers. It's like rebooting your strength. Sixth, cross-body brain drills. Lift your right knee while tapping your left shoulder. Then switch. Now trace your name in the air with one finger while balancing on one foot. These drills might feel goofy, but they activate both sides of your brain. Balance isn't just physical. It's neurological. Seventh, slow motion strength. Sit down into a chair over 10 seconds. Hold. Then stand over 10 seconds. Repeat. No dumbbells. Just your body and control. This builds functional strength. It teaches your body to move with intention, not inertia. What's amazing is how these 7 things, done daily, create a ripple effect. People report less knee pain, better sleep, faster reaction times, more energy. These aren't miracles. They're simply your body responding to intelligent signals. And here's the truth doctors won't tell you, most age-related decline isn't due to aging. It's due to disuse, misuse, and poor movement patterns repeated for years. But the brain and body are plastic. They adapt, even at 90. Geraldine now plays on the floor with her grandkids. She hasn't needed a walker in months. Harold hikes again. And there are thousands more. The difference? They stopped relying on walking as their only exercise. And they started training smarter. Don't get me wrong, walking has value. But it's not a cure-all. Especially not on misaligned joints or tight fascia. The smarter path is what you've just learned. And the best part is, you can begin today. Right now. No equipment. No gym. Just you, your breath, and a few minutes. So here's what I want you to do next. Pick one of these 7 tools. Start with it today. Just one. Then tomorrow add a second. Build momentum. And in a week, your body will already be shifting. You owe it to yourself to try. You owe it to the years ahead. Don't let outdated advice steal your mobility. Choose knowledge. Choose action. And watch what happens. This is Dr. James Kellen, rehab specialist of 22 years, signing off with one reminder: you are not broken. You are not too old. You are simply underactivated. Let's change that one smart movement at a time. Stay tuned because the real transformations are just beginning. So now you know the truth. Mobility isn't lost because of age, it's lost because of neglect. The good news? That's reversible. You've just been introduced to a different kind of movement, one that taps into your body's deep reserves of strength, balance, and coordination. These 7 daily tools are more than exercises, they're signals to your nervous system to wake up, reorganize, and thrive again. You don't need to overhaul your life. You just need to take one small, intentional step. That's how Geraldine started. That's how Harold got off his cane. They didn't join a gym or buy a program. They started with one movement, then another. And now they move with confidence and joy. Your path to renewal doesn't start with intensity. It starts with consistency. One breath, one rep, one choice. Remember this: you are not past your prime. Your nervous system still listens. Your muscles still respond. Your joints still crave intelligent movement. All it takes is your willingness to try. Age doesn't limit you, habit does. But new habits are always within reach, no matter what decade you're in. So what now? Pick one of the 7 tools and do it today. Let your body feel something different: less strain, more space, more control. And tomorrow? Add another. Layer by layer, you'll feel what thousands of others have: a return of energy, balance, and purpose in movement. This isn't a trend. It's your biology reawakened. This is Dr. James Kellen, signing off. You're not broken. You're underactivated. Let's change that together. One smart movement at a time. And if you found value here, stay with us. Because what comes next may just transform the way you move for the rest of your life.